Good morning, everyone. Welcome to our episode 13. Can't believe it's been 13 episodes already. Today we're going to switch it up and we are going to talk about some male plastic surgery and specifically my most common surgery that I perform for males, and that's going to be gynecomastia. So we'll talk about gynecomastia in men and how to treat it. And so even if you're a woman, I think it's, beneficial to listen. I think women can push sometimes their spouses and give them more information. That's where we get a lot of our medical information is from our spouses and significant others. So I think it'll be an informative topic this morning, a little bit different because we'll be talking about men. So we'll wait a few minutes, get people to join, and then we'll start talking. And unfortunately, there's some construction in the building, so you may be hearing some things. Hopefully it's not too annoying. Okay, well, let's just start. And, we'll start briefly with, talking about gynecomastia and what exactly what is that word? And it's something that is deals with men, and more than likely, a lot of people are unfamiliar with the term, and it's a condition called gynecomastia. It's not commonly discussed in social circles. Men don't openly talk about their insecurities with gynecomastia, but in fact, it is very common, and many men deal with it on a daily basis. And so what exactly is it? Well, it's a condition that causes excess glandular tissue due to the male chest or due to the male chest. So the male breast becomes actually swollen and enlarged, and it can, in some degrees, almost resemble a female breast. And some studies have shown that about 65% of men through their lifetime do struggle with gynecomastia. And, it can occur any stage of life. And, it can be quite, sometimes it can be painful, and sometimes it can be even embarrassing for men to where they really don't seek help for many, many years. So, job is really to just try to educate about this topic so that people can talk about it, and if men, listening to this, can understand that this is a medical condition and that their confidence can be restored, usually with a surgery, with an outpatient surgery. So, again, what is it? It's, again, enlargement of the male breast tissue. It's thought to be a result of, due to a hormone imbalance. And basically it's when testosterone levels in men decrease versus the level of estrogen in the body. And so what happens is then the breast tissue itself in men gets responsive to that estrogen, and then the male breast begins to enlarge. We see it a lot of times in puberty. And then, a lot of times it only lasts for just maybe a couple of years, and then it goes away, after just a few years, and sometimes it can go away on its own. We see it with certain types of drugs, so certain types of prescription medications, even some over-the-counter medications, and then also see it with anabolic steroid use. So it's very common for men who have taken anabolic steroids. Sometimes, their testosterone levels and estrogen levels get out of whack, and it can actually promote enlargement of the breast tissue in men. Let's see, marijuana is also another cause, and we see that in some men who smoke marijuana every day. Sometimes that can trigger the breast tissue to enlarge. So there's a lot of different causes, and when I see patients for gynecomastia, we really have to make sure that the reversible causes are something that is not continuing. So if someone sees me and they're smoking marijuana very heavily, or they're actively using anabolic steroids, we first want them to try to stop that, because no matter what surgery that I do, it can still cause the breast tissue to come back, or really not effectively treated. So we go through an extensive medical history, seeing if there's any identifiable cause, and if there is, then maybe we can just change that and you don't need surgery, and then the gynecomastia can get better. It can be some other serious health conditions, sometimes problems with the liver, some type of other hormone imbalances like hyperthyroidism. And so, again, we have to really kind of make sure that there's no medical causes before we embark on surgery. Now, the most common cause, though, is usually, it's just what we call idiopathic, that after we go through that extensive medical history, a lot of times men don't have any of those reversible causes, and they just have enlargement of the breast tissue. Sometimes we see it with a little bit of weight gain, and despite diet and exercise, some men will just keep some enlargement of the breast gland, and they surgical intervention to help with that. So again, what's mainly the symptoms, and what are the varying degrees? Well, some men, and especially we see this in puberty, sometimes they'll have a little bit of hard nodule or hard mass that's underneath the nipple. And that's the easiest, I think, for surgical intervention. We basically just make a small incision, and we remove just the really well circumscribed mass that's right underneath the nipple, and that comes out very easily, and that can usually be done under local anesthesia. And then there's kind of a condition to where there's a little bit of a mass, but there's a diffuse fatty tissue that's underneath the skin and in the breast gland itself, and that usually needs a combination of excision as well as liposuction. When we do liposuction, though, the fat is different than other parts of the body. And so the fat for gynecomastia is usually very fibrous, and it's very resistant to just traditional liposuction. So usually we have to talk about some type of energy device, whether that's a laser liposuction or ultrasound liposuction like the Vaser. That's usually better to break up that fat, and then also kind of cause a little bit of some skin retraction. So, for those patients who have a little bit of a palpable mass underneath the nipple, and they also have a diffuse fatty tissue of the gland, we usually do a combination of excision as well as some type of liposuction. And then there's some men who have excess skin, and so we see a lot of this with sometimes it's just with genetics and with puberty, but sometimes it's with massive weight loss as well. And so they will have diffuse fatty gland of the chest, but due to the weight loss or just due to the way that their gynecomastia is, they have a lot of loose skin. And so when that happens, just liposuction and just excision of the gland is not appropriate, because the skin's not going to contract. And so for those patients, we have to actually take off some skin and decide how can we orient the scar to be in the best cosmetic way. And more often than not, for those patients, we have to put at the crease of the breast, so really what we call the inframammary fold. And that's a big scar. And most of the time, usually we have to take off the nipple and put the nipple back on as what we call a full thickness skin graft. And so that's really the most advanced surgery for gynecomastia. And, a lot of patients will, a lot of my patients have gotten tattoos, after that surgery to somewhat hide the scar. But the satisfaction is very high because these are men who really don't want to wear tight-fitting shirts because you can see the gynecomastia through the shirt, and they're really just happy to wear a tight-fitting shirt and not feel self-conscious about it. And if we go through all the different scar management processes, throughout that year, scar gel, silicone sheeting, and whatnot, and it takes a full year for those scars to heal. And if they're still unhappy, then a lot of times a tattoo, just of whatever they like, can hide the scar and really make them look very natural. So those are the kind of the surgical treatments. Again, it goes from things that we can do under local anesthesia, where we just do a little simple excision of a mass that's underneath the nipple, and then it can be liposuction by itself. So some men really don't have a mass underneath the nipple; they just have diffuse fatty gland of the chest, and that's very easy to do liposuction and really address that condition. And then again, sometimes it's a little bit of excision, and I think that's the most common, where we make a small incision in the areola, hide the incision, excise some of the tissue, as well as do liposuction. And then we have the patients who have significant amount of weight, of skin excess. And for those patients, it comes with a big scar where we have to take out skin and then relocate the nipple as a full thickness skin graft. So those are really the conditions. Again, it's very common. It's my most common procedure for men. I think it takes some time for men to build up the confidence to go to a plastic surgeon's office. And so hopefully that this just gives some education for you guys to share with your friends and family, that it is very common and it's something that is easily treatable, and the results are usually fantastic. So let's kind of go through some results. I have some on my website, and we'll kind of just go through some. So you can see this young guy, really doesn't have a significant degree of gynecomastia, but he was, self-conscious wearing a shirt, and just not feeling confident on the beach and whatnot. And so for him, we can make small incisions, hide them. You see on the post-operative picture on the right, you can't really see any incisions. And we did laser liposuction to the whole chest to really kind of define the chest and really have the pectoralis muscle be more visualized. I also did a small excision of the gland, and that's just with an incision that hides within the areola. So very, easy to hide incisions, and then, very rewarding surgery. And this was even done under local anesthesia. So you can see on the left, he has that kind of budding tissue underneath the areola and underneath the nipple, which was really kind of making him feel self-conscious. And this is something, unfortunately, that a lot of men just live with, and they think that this is just how there's really not a good solution for. And there really is. And the solution is something that my goal for these patients is to make it look like I wasn't there. And if you look at the post-operative result, his chest is way more defined, and it doesn't look like he had plastic surgery. And I think that's the crucial point of all of this. Okay, so let's look at, you can see there again, his left chest just has that budding of some tissue underneath the nipple areolar complex. We make a small incision. Again, we can do this guy under local anesthesia, excise some of the tissue, do laser liposuction, and really kind of hide all the incisions and make it look very, very natural. Again, so that's all views, all angles to kind of show you that the scars are hidden and we can really get very, very natural results. Okay, I'm gonna show you this other guy. And so this was a guy that just had a unilateral gynecomastia. So there was just one side. This is only a month out, so you can see a little bit of the bruising still. He was so happy that, he just, again, guys don't like to go to plastic surgeons' offices. So, we just communicated over the phone and he was fine. So this was the only picture that I could get from him. But you could see, again, he just has diffuse kind of fatty tissue in the gland, and he has some excess skin there, but no skin was excised. And so what we did was just excise a little bit of the gland by making a small incision in the areola and then doing laser liposuction. So part of the laser liposuction allows that skin to contract post-operatively, and you can see we have a really kind of nice result. On the left, you can see that it almost resembles a female breast, and so that can be very embarrassing for men to have that, especially someone who works out a lot and whatnot. So really just after the surgery, on the right you can see his pectoralis muscle more, and really all of that excess glandular tissue is gone. Okay, so in summary, gynecomastia is something that's very common. It's my most common surgery for men, and it can be done under local anesthesia. I would say more often than not, I'm doing it under general anesthesia because we're just getting really more aggressive with the liposuction and the excision to just give more defined results. And the only way to really do that is to have the patient fully asleep. And so, it's very treatable, very common. And so if you know anyone who's suffering from gynecomastia, there is a solution out there. So just spread the word. Any specific questions from anyone? Okay, so this will be on for 24 hours. So, any who knows any man that wants to kind of learn more about gynecomastia, you can kind of tell them to watch. Again, we went through some the common causes, the common surgical interventions, as well as some results. So someone asked, what's the downtime? So really it's about a week of soreness, I tell patients. So it's like 1 week of soreness, and really patients will wear a compression vest for about 4 weeks. There's usually not any drains in place for the most common surgeries for it. And really after a month, the patient is kind of free to exercise and free to do anything that he likes. So usually just a 1 week of soreness, probably 1 week of being off work. Okay, well, again, we'll continue to be doing these things as long as we're in quarantine. So again, like I said before, if you guys have any topics you want me to discuss, feel free to DM me, and we'll try to get that topic discussed for you. Hope everybody has a good day, weekend, stay safe, and we'll see you next week.